Thank you very much, Madam Chair. This will be brief. So what we have is we had this special session that occurred, and there was a lot of interest in including legislation that will directly impact local public health districts, local public health district authority to respond, for example, to a pandemic or to other types of outbreaks that may occur. None of that came to be. The special sessions, as you know, are narrowly defined, and we're hearing a lot, my colleagues around the state, different boards of health members from around the state, about legislation that's likely to come this coming legislative session. So I just wanted to, this is sort of a primer to, we need to be very prepared for that. Commissioner Hasbrook, as our trustee and executive council member, has been involved in at least one conversation with the other executive council members from each of the 7 public health districts or the 6 other public health districts. And they're going to meet again on October 29th to further this conversation. But I just put it out there mainly for your awareness at this point, but I think we're going to have to be very engaged in tracking what happens very, very closely so that we can essentially maintain the I think, exceptional structure that we have in the state and the authorities that we've been able to exercise to keep people safe during the pandemic and certainly during other outbreaks that occur outside of the times we're in today. The only other item I have is just a quick preview of next week's board meeting, which will be on Tuesday at 5:15. We are going to present proposed orders, modified Ada County orders to allow visits to long-term care facilities with restrictions. And when I say with restrictions, our goal is to allow families, friends, other loved ones to be able to visit residents of long-term care facilities, but to be able to do it safely. As we know, our cases in Idaho are continuing to climb, as they are here in Central District Health's 4 counties. So it's not something we're going to take lightly. We're putting a lot of thought into it. I'm hoping to have it published on our website as a draft by Monday, and again for the Tuesday meeting. And then the other agenda item for Tuesday was requested by a board member is to revisit the school operational plan. So I reviewed that with all of you on Tuesday as far as the history, kind of the local boards, school district boards, authorities, the state recommendations that came out from the State Board of Education and others at the state level, and our decision to recommend that schools in Ada County, while in red, be basically continue to operate at the phase that they're at with in-person learning. I don't think any school's full on K through 12, 5 days a week in-person learning. We're asking them not to continue to advance that, but to kind of hold where they're at, as well as to pause close contact athletic sports. So that's, again, a request by a board member, so I'm going to put that as a second item on the agenda. So we'll have 2 items, as well as probably the review of the minutes for today. And that's all I have, Madam Chair.
Okay, thank you, Russ.
Madam Chair, this is Al.
Yes, Russ, go ahead.
Russ, I got a question for you. Our executive council conference call is for 29th, and on the agenda it talks about discussion on hiring support for LPH voice with the legislature. Can you tell me what LPH is? Is that just local public health?
Madam Chair?
Yes, go ahead, Russ.
No, that's exactly it. It's local public health.
And I need to ask the board how you guys feel about, because I'm sure the question is going to come up, are we willing to throw some money at possibly a lobbyist for the public health? Or, you know, it used to be that IAC did that for us, but they don't really lobby for us. They just kind of keep us informed. And this discussion came up here a while back about maybe we need our own separate lobbyists. And I want to know what the feeling from the board is on expending some money towards our own lobbyists for all the health districts. How does everybody feel about that? And then I also gotta tell you, I've got the 2% on my computer, so I might lose you any minute.
Comments from board members?
Madam Chair, this is Ted.
Yeah, go ahead.
Maybe Russ, you can educate us on this. As a public health department, are we allowed to do that in terms of a lobbyist? I don't know exactly what the rules or law are about us as a quasi-governmental entity. Can we do that?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
My understanding is that we can. We have done this in the past for different pieces of legislation. The one that I was really directly involved with a number of years ago was on the food license fees. So we have used Mike Kane in that capacity, and he has registered as a lobbyist for our public health district, or in that instance for all 7 public health districts.
What you just said in terms of your concern about watching carefully with legislative activities that will come up this year. I think we might want to do what Elk's suggesting, if indeed it's going to be harmful or deleterious to the public health mission and role. So those would be my feelings at this time. I guess maybe, Megan, we can ask you a question. What do you think about this? Is there anything that we should be concerned about, that we would potentially want to have our voice better heard?
I don't know that by hiring a lobbyist that it's going to advance your position for the cost. So I wouldn't be interested in putting money that direction. I understand that I think people overestimate the effect that would have, but it's kind of on you. I will say I've seen drafts of what's coming through. Some people have some pretty strong feelings about what's happening. I think the chance that there would be 0 changes to the system are very, very slim. So I think that probably what you'll want to do is rely on Association of Counties and to have them follow it. But as far as hiring a lobbyist, I don't know that you're going to get enough out of it to make it worth the expense or the use of taxpayer dollars.
Madam Chair, this is El.
Yes, El, go ahead.
I kind of feel the same as Megan does right now. I think I've noticed the last couple of years, the Executive Council, there's some members on there that really want to kind of jump the gun on a lot of these things, try and get ahead. I'm not sure where the conversation is going to go when we do have this, but I think right now for our $12,000 we pay every year to IAC, we're getting that representation. Seth is letting us know kind of what's coming down the pipe. But I wanted to get your guys' feeling before I expressed that during the Executive Council, how you felt about it. So it's not my decision, it's the board's decision. And I agree with Megan. I think we just need to keep writing this and see where it goes. And then maybe have to react later on in, who knows, maybe February or January sometime, if we start seeing some bills come through. We know it just isn't gonna work.
Madam Chair,
Yes, Megan, go ahead.
just a point of order. We don't have this as an action item. So it would need to be added, just to remind everybody, we would have to add it to an agenda if you want to have any kind of motion on this.
Yeah, but I think it's important to get your guys' feelings on this, how you feel about this. That's part of the trustee's job, is not to vote my own personal beliefs, but it's the board's beliefs.
So I'm tracking with everyone else here, Elt. I would say, I mean, Representative Blanks, you have your fingers on the pulse of the legislature probably more than any of us. So I hope you'll keep us updated on where we're at. We can have some robust conversations about that. We'll all see what happens. It's always a rockin' good time.
Madam Chair, this is Ted.
Yes, Ted, go ahead.
Yeah, I hear Megan's point. If we were going to take a formal action, I totally agree we would need to agenda this. Since El just asked a general question, I would just opine that I think we do stay with just the IAC at this point. And if there were something that would need more advocacy, then we could put it on as an agenda item and discuss and potentially go the lobbyist route. I think status quo right now is okay with the IAC. And then we could see how things develop in the legislative session.
Matt,
Yes, who just spoke?
this is Jane trying to speak.
Oh, okay, Jane, go ahead.
I just wanted to know Russ's opinion on that.
Madam Chair, it's kind of a difficult situation, because if you wait too long and we get behind and we don't have anyone in a position to represent us besides Idaho Association of Counties, you might never catch up. We've had legislation brought forward just about every legislative session, from environmental health issues and septic systems and immunizations, and it just depends on how much traction legislation gets and how quickly it moves through both bodies of the legislature. So I guess my thought at this point in time is, let's have ELT report back to this group after the 29th. Seth Brigg, the executive director of the Idaho Association of Counties, has been participating on those calls, and I expect he'll be on this one. And my suggestion is not to make, obviously we're not making a decision today. He's looking for the sense of where the board wants to go, and then based on the discussion on the 29th and maybe subsequent discussions with the executive council, and then make a decision.
Thank you.
Yeah, thanks, everybody. That helps me out a lot, because at least I know what's going on. Thank you.
Okay. Any further comments?
Madam Chair, this is a separate question for Russ.
Yes, go ahead, Ted.
Russ, maybe if you could just give us just a quick overview of where we stand with influenza. I know we've got several active cases now in the community that are test positive. A couple questions. Number one, Russ, how much activity do we have? Number two, any suggestions from the public health perspective, because the potentiation of COVID and influenza together are synergistic. It's a 1 + 1 = 5 sort of scenario with people getting both infections. So any thoughts on one, level of activity, two, do we need to do anything different at this point from your perspective?
Madam Chair, this is Russ. Yeah, Dr. Epperly, exactly what you just said. We're starting to see activity. We're starting to hear of cases getting reported, or sentinel surveillance, so it's not a reportable disease. We don't track it, a specific number of cases. Certainly not like we're doing with COVID. So that, number one, absolutely, we're starting to see it already. And as far as what we should do, is what we're currently doing is working to heavily promote getting the flu vaccine. There was some information coming out of the southern hemisphere, right? They're coming out of winter, where some countries were able to keep flu at bay. But from what I understand, and those from the reliable data that we received, a lot of those countries were in a lockdown mode. People weren't leaving their homes. They weren't even going to their workplaces when they could work remotely. So I think that's a far different scenario than what we're seeing in the United States, and certainly here in Idaho. So I think we're going to see a lot of flu this year, and to your point, having flu at the same time as COVID will likely far increase the number of deaths we've already seen, which, as you know, as a family physician, are more than double what we would typically see in a flu season just from flu. So I suspect it's going to get far worse, and we will continue to push that message of how important it is to get the flu vaccine.
Yeah, thanks, Russ. Appreciate that.
Okay, thank you. Any further items to discuss before I call for a motion to adjourn? Hearing none, I will call for that motion for adjournment.
Madam Chair,
I,
Go ahead.
a motion that we adjourn.
I'd second that.
Who's that?
Megan.
Any further discussion? Hearing none, I'll go ahead and call for a vote by county for adjournment. Valley County,
Commissioner Hasbrook, aye.
Elmore County,
Representative Blanksma, aye.
Boise County,
Commissioner Sturm, aye.
Ada County,
Jane Young, aye.
Ted Epperly, aye.
Commissioner Laciando, aye.
Okay, motion for adjournment passes. Thank you, folks. And as Russ mentioned, our next meeting will be next Tuesday, the 20th at 5:15. And I want to thank everybody for their input and participation. And thank you for the public who's listening in. So at this point, our meeting stands adjourned, and have a wonderful weekend, everyone. Bye now.
Stay well, everyone.
Thank you so much.
Yep.